Dr. Ade. Good afternoon, everybody that has attended this session, this last session. Thank you very much for your attention. And today, right now, I'm going to present about the bone mineral density, exercise habit, and muscle strength of young Indonesian women. As we know, osteoporosis is one of the degenerative diseases that is marked or characterized by the decrease of bone mineral density. And osteoporosis itself has been known as one of the major health problems in Indonesia, as it is promoted by two big organizations in Indonesia. The first one is Perhimpunan Osteoporosis Indonesia, which is an organization of medical doctors that has interest in osteoporosis, such as the OBGYN, the internal medicine, and etc. And there's also a public organization, a non-profit public organization, which is called Perkumpulan Warga Tulang Sehat Indonesia. These two organizations has been promoting about osteoporosis and has been trying to get government support, and it's a very good thing that our government has been supporting the efforts to prevent and also to treat osteoporosis from years to years. But as we know, osteoporosis is not only happen in older age. The pathophysiology of osteoporosis actually has been begun since the young age, and not only since the young age, it's actually since the pregnancy period until the achievement of peak bone mass around the adulthood, the adolescent and young adulthood period, and also for the rest of our life. And as we know, especially for the female, there will be some period or some moment that there will be a natural decline of bone mass that happen especially because of the menopause period. That's why we conducted a study to know the prevalence of low BMD, the profile of lifestyle habits related to bone health, especially physical activity and also the calcium intake, the difference of lifestyle habits between women with low BMD and normal BMD, and the difference of muscle strength between the women with low and normal BMD. This study was, as has been said by Dr. Ade, it is a study that was granted by the International Osteoporosis Foundation. It's a cross-sectional study that were done on women at the age of 25 to 35 years old, living in Jakarta and its surrounding area. These were the inclusion and exclusion criteria with the focus on the non-pregnant and non-lactating women, and also we exclude all the women with the medical conditions or treatment that can affect the calcium metabolism. So in the study, the subject will, the data will be obtained by using the questionnaire and also physical examination and muscle strength tests, and at last the BMD examination. There were two questionnaires that were used. The first one is the questionnaire that were specially designed by the authors, which to collect the history of the health and also about the exercise habits and other lifestyle factors. And the second one is the Global Physical Activity Questionnaire. This questionnaire is to assess the physical activity level. This questionnaire was made by the World Health Organization and assessed three aspects of physical activity, which are activity at work, and then the traveling activity, and the recreational activity. Before doing the muscle strength test, the researchers let the subjects to do initial stretching for the upper and the lower body. And then the muscle strength tests were done using dynamometer, the hand grip dynamometer, and also the back and leg strength dynamometer. And the BMD were examined using DEXA machine for the three sites of common osteoporotic fracture, which were the wrist, the lumbar, and also the femur. So we collected 443 subjects, young Indonesian women, and most of the subjects at the age of 30 to 35 years old. And we found that the low BMD prevalence could reach almost 50%. So 44% of the young Indonesian women, the young women or the subjects, had osteopenia, and 2% of them already had osteoporosis. And this finding, compared to other previous study, actually much higher. And on the other hand, we were selecting similar studies from other countries, also Asian countries, with similar condition actually with Indonesia, which were India and Thailand, but yet they found much lower prevalence of osteoporosis. But this fact, of course, can be affected by the various socio-demographic factors that we know highly affecting the prevalence of osteoporosis. And then we also examined the anthropometric parameters such as body weight, body height, and body mass index. And as has been found by previous studies, body weight and body mass index show significant, and also the body height in this finding, show the significant relationship with the BMD, which we can see that subjects with normal BMD tends to have higher body weight, higher body height, and higher body mass index. And from the nutrition intake profile, we see that the osteoporosis subject has the lowest calcium intake compared to the normal and the osteopenia subjects. But overall, we can see that actually all the subjects has a very low calcium intake compared to the calcium intake recommendation, which is actually 1,000 milligram per day for women age at the young adult age. And then for the physical activity level from the GPAQ questionnaire, we see that most of the subject actually has a low physical activity level. And when we compare among the group of normal BMD and low BMD, we can see that the low BMD group has a higher percentage of subjects that have low physical activity level. But in this analysis, we didn't find any statistically significant result. And the previous result is actually supported by this result, which is about the exercise habit. In this question from the questionnaire, we found that almost 3/4 of the subjects, or almost 75% of the subject, actually had no exercise habit in the last 6 months. And the one that had exercise habit also only doing it less than 3 times a week, which actually less than is recommended by the national or international organizations. And but from this analysis, when we analyze this data based on the BMD result, we didn't find any statistically significant difference. And if we see the BMD result even more detail into each specific size that was examined, we see that actually the highest osteopenia and osteoporosis prevalence was on the wrist. We see that 35.2% of the wrist BMD result were osteopenia, and 1.4% of them is osteoporosis, compared to 15 and 17% of the lumbar and femoral neck, and 0.7 and 0.2% of osteoporosis on those sides. And if we see analyze the muscle strength test result based on the BMD result, we can see that there's a significant difference of the muscle strength test result among the BMD group. That the normal BMD has the highest muscle strength test results compared to the osteopenia and the osteoporosis group. And moreover, if we did the analysis, the specific analysis for each side of the strength test, where the hand grip strength test result analyzed based on the wrist BMD result, and the back strength test result was analyzed based on the lumbar BMD result, and the leg strength test result was analyzed based on the femoral neck BMD, we can see there was a statistically significant result or difference actually between the normal, the osteopenia, and the osteoporosis group, where the normal BMD group again had the highest muscle strength test result compared to the osteopenia and the osteoporosis. So we can conclude actually that there's a relationship between muscle weakness and low BMD. Previous researchers has been trying to formulate how this can happen. It is said that the muscle strength or the muscle contraction actually gave a mechanical signal that will affect eventually the bone formation and the bone remodeling process. But how this mechanical signal can be translated to affect the bone formation and bone remodeling is still a question and still being studied. There are two theories that has been said, which is through the chemical signals, and the second one through the electrical signals. And this whole process, again, were said to be affected by various factors, including environmental factors and also genetic factors. So from this study, we can conclude that almost 50% or exactly 46.2% of young Indonesian women had low bone mineral density in at least one of the three sites. And then subjects with low BMD have lower muscle strength value in all sites. But in the statistical analysis, we didn't find any significant relationship between physical activity level and exercise habit with BMD. But at the end, we also realized that muscle strength cannot be increased without doing any regular or good physical activity and exercise. So from these findings, we suggest that we as healthcare providers can give an effort to increase the public awareness about the osteoporosis, about how we can prevent osteoporosis since pregnancy, children and young adults, and about the importance of physical activity and exercise in preventing osteoporosis and also achieve a complete health and fitness level, and about the importance of calcium intake recommendation. And also from this study, we can also suggest that we need to do further study to learn about the social factors that affect osteoporosis occurrence in Indonesia. And thank you very much for your attention.